This flight of stairs is going to be bright and cheery, and if you're afraid of elevators, it will be welcoming. And here is going to be a bank of child-friendly elevators that only come to us, so you won't lose anybody in transit. What's really cool about this is that as people walk in, the eye is going to bring them the way that we want them to come, so that a child or adolescent with autism will be following visually, and will follow right over to here, where we're going to have the circular check-in desk that, using wayfinding, will guide the eye around to the left, where check-in will be with the techs and nursing staff, and then around the back to where the therapy rooms will be on the left and the exam rooms will be on the right. Nobody likes to admit that we ever have to wait, but there is waiting time. And we're going to attend to all of the things that families and youth told us, with dampening of the sound, friendly lights, colors that will make you feel calm. There's going to be a sensory touchdown room, so that if somebody has an issue coming into the clinic, there'll be a separate sensory room right here.
We're going to have a really nice family library over here. Our family library is going to be staffed by a family navigator who's going to meet with our families, who's going to talk through families maybe who have just gotten a recent diagnosis and help support them and help them figure out what to do, finding the resources they need, connecting with community groups, understanding how things work, really find the supports that they need.
And this is really, really, really important, being so welcoming yet private here right off the waiting area will make families feel comfortable and really use her for resources.
And we will also have a child care room that will be very important. It will be staffed by Child Life, so people who really understand working with children, and that will be somewhere that siblings can go while another child in the family is having an appointment, but even more importantly, it's where the child who's there for their appointment can go while their family is talking with their child's team.
Across the waiting area, we'll have a separate area for teens. A lot of teenagers don't like to be with little children. This will provide a separate area where we can have group work done, as well as teens engage in other activities.
Our feeding space is going to be over there, a full kitchen, 2 feeding therapy rooms that are really set up nicely for kids to have therapeutic meals in.
We'll be in the same physical space in this building with child and adolescent psychiatry and child neurology. As Dr. Shore, the chair of the department, says, you only have one brain. Only one brain. And we need to collaborate around issues like anxiety and aspects of counseling that we can't do, so that we provide appropriate diagnostics and provide the behavioral services. We're anticipating that this sensory-friendly space will be of great benefit for collaborative care, of great benefit for teaching.
Over this way is going to be our teaching space. All of our trainees from neurology and child psychiatry and developmental pediatrics are all going to work together and have some joint training opportunities, so that all of us can increase our skills in all of those different areas. That'll be really nice for our families to really know that their team is working together and that we're developing professionals for the next generation of kids.
This really has been a labor of love, trying to figure out how we, in making this new building, can really facilitate the therapeutic process and have the built environment be conducive to counseling, to therapy, and to diagnosis, just like the Children's Hospital, that the built environment is really part of the entire treatment plan. And that's what makes it so exciting for us. I'm not going to say 99% of our patients, 99% of our patients would love just the construction. It's big boy Legos.
We are super excited. This is great.
This is awesome.
It's really amazing.